we think of ourselves as being one world, sort of, because in healthcare we do different things depending on the health economics in that world. And in the United States, frankly, we're incredibly wasteful with our resources. But on the flip side of that, we have access to a lot of things. And so we do a lot of broad molecular profiling on almost everybody with metastatic disease. That's part of our culture there now. It's almost an expectation there now. And many of the therapies depend on those tests, and many of our indications depend on that test. One such as tumor mutational burden being elevated. We have therapies, immune therapies in the states that are approved under that setting. Well, when we come to a meeting like this and see that our friends in the EU don't have the same access that we would have. So the testing is different in different places. The other thing that really comes out to me is that we are equating in our scientific lectures all of these tests being the same, when in fact they're not. They're of different quality. When I think about oncologists understanding what a CAT scan would show, let's say, versus an MRI, or contrast CT versus non-contrast CT, we know what that test is showing us, but also what it's missing. We don't yet really have the same instincts around precision medicine. And so I think one of the themes that needs to be brought more strongly forward is that our tests are not the same. We can't say A is A because A is B and they're different.